Morning, my dear students. Today I am going to present the topic for first B Form PIC Unit 1, that is Unit 3, that is gastrointestinal agent. Before starting this gastrointestinal agent, let us discuss about the gastrointestinal definitions. So the gastrointestinal agents are the substance or the drug which treat which is going to treat the disorders related to the gastrointestinal tract. For an example, acidity, constipations, and achlorhydria. These are the conditions where these are the few conditions which are going to be commonly existing in GI systems in a day to day in every individuals. So for treating all these type of disorders, we require some gastrointestinal agents. That is going to be called as gastrointestinal agents. In this gastrointestinal region, in this gastrointestinal tract, we having a three uh, subheadings. One is acidifying a reagent, second is antacids, and third one is cathetics. So let us see one by one. The first is acidifying reagents or acidifiers. What is meant by acidifiers? These are the agents or the drugs which are going to be able to increase the acidity in GIT tract. Some of these drugs are used to increase the metabolic acidosis, whereas some of these are used to increase the gastric hydrochloric acids. So let us see the classifications of acidifiers. Broadly, the acidifiers are classified into gastric acidifier, urinary acidifier, systemic acidifier, and acids. Then gastric acidifiers, the gastric acidifiers are the acidifiers which is going to increase the acidic, which are going to increase the content or the level of acid in the GI systems. That is going to be called as a gastric acidifier. Whereas urinary acidifier, these are the drugs which are used to render acidic urine to enable treatment of some type of urinary tract disorders. The second one is urinary acidifier. These are the drugs which are used to render acidic urine to enable the treatment of some type of urinary tract disorders. The third one is systemic acidifier. These are the drugs which are unable to neutralize the alkaline bodies fluid, particularly blood, in the patient who are suffering from systemic alkalosis. So this type of systemic acidifiers are the acidifiers which are going to be given to the patient who are suffering from systemic alkalosis. Systemic alkalosis is the type of disorders where the pH of the blood is going to be increased to the alkaline state. And last one is acid. These are the used in the pharmaceutical aid in the preparations of laboratory quality controls. So let us see the one by one the examples for the acidifiers. So the first example is dilute hydrochloric acids. So this dilute hydrochloric acid is one of the important agent which are going to be used in the treatment of achlorhydria. Achlorhydria is the conditions where the person is suffering from less secretions of hydrochloric acid in the GI systems. So for the treatment of achlorhydria, we are going to give acidifiers. The example for acidifier is dilute hydrochloric acids. Now we can individually we can see the how the individual monograph of these hydrochloric acids in the terms of ingredients, preparations, properties, assays, and dose and storage. So let us see. The first one is dilute hydrochloric acids. So the dilute hydrochloric acids, it contain 10% weight by volume of hydrochloric acids. As per the Indian Pharmacopoeia, the limits is 9.5 to 10.5%. So what are the ingredients for the dilute hydrochloric acids? The dilute hydrochloric acid consisting of 274 gram of hydrochloric acid, and the purified water is consisting of 726 gram. So both it is going to be taken in the gram, as the hydrochloric acid and purified water is going to be having the specific gravity of 1. So as 274 gram is indicating the same as 274 ml, and whereas purified water 726 gram indicating the 726 ml. Now the preparations of dilute hydrochloric acid. The dilute hydrochloric acid is going to be prepared by taking 274 gram or 274 ml of dilute of the concentrated hydrochloric acid, and it is going to be added gradually to the water. Water contains 726 ml, and then the solution is going to be mixed properly, and it is filtered, and it is going to be stored in a white color bottles. So this is the preparations of the dilute hydrochloric acid. The second one is properties. What is the properties of dilute hydrochloric acid? The properties of hydrochloric acid, dilute hydrochloric acid, it is in a colorless liquid, it is in strongly acidic, and has about 1.04 to 1.05 pH range, and pH of 1.04 to 1.05 specific gravity. What is identification for the dilute hydrochloric acid? It complies with the test 1 and 10 2, which have been already described. So now we can see the assay. What is the basic assay procedure involved in the dilute hydrochloric acids? So what before that, what do you mean by assay? So assay is nothing but it is in a one of the test, but it is one of the quantitative analysis where we are going to perform to check the purity of the compound. It is a qualitative analysis in which you are going to perform the quality, or it is going to check the purity of the given compound. So assay is nothing but to ensure ourselves that what the percentage purity of the given compound or the samples. So the assay procedure is as follows. Transfer accurately 40 ml of hydrochloric acid to the flask which is having 40 ml of water. Now the solution is titrated against 1 normal sodium hydroxide using methyl orange as indicators. This is the equations NaOH plus HCl. It is going to form salt plus water. So this assay principle is basically upon the simple acid-based titrations, where the acid, that is hydrochloric acid, is going to be taken in the conical flask, and the burette we have taken 1 normal sodium hydroxide, and the indicator is methyl orange. So this is in a simple acid-based titration by which the color changes is going to be happening. It indicates the end point of the titrations. So this is the assay procedure and principle. Now let us come to the storage. It is stored in a well closed tight container, and it is going to be stored in amber color bottles. So amber color or colorless bottles. If it is going to dilute hydrochloric acid, it can be stored in a color bottle or colorless bottle also, and keep it away from direct from sunlight or light. Dose of this dilute hydrochloric acid, it is 0.6 to 8 ml as per the need and as per the severity of the requirement by the patient. Then lastly, we come to the usage or the use of the dilute hydrochloric acid. As before I given the label for this one, this dilute hydrochloric acid is going to be used as an acidifier agent, and even it is going to be used as in a pharmaceutical aid, and as also it is going to be used as in a solvent in the pharma industries. So this is all about the monograph analysis of dilute hydrochloric acid. Okay, my dear friends, now I'm going to discussing the the second topic, that is antacid. All of you know that acidity is one of the biggest problem right now in the society, because more number more more usage of fast foods, spicy foods, which increase the acid content in the stomach and causing the acidity to the individual or the person. So for the treatment of acidity, you require some alkaline substance which is going to neutralize the excess acid which are going to be secreted in the GI systems. So for that treatment of acidity, we require the antacids. The term antacid is come from there. So antacids are the substance, or it is an alkaline substance which are going to be used to neutralize the excess acids in the stomach of the patient suffering from hyperchlorhydria, or we can call it as an hyperacidity. This drugs gives relief of the pain due to hyperchlorhydria, and it is also possible to measure the efficacies of the antacids in terms of neutralizing capacities. Antacids may be classified as systemic antacids and non-systemic antacids. Systemic antacids, these are soluble, readily absorbable, and capable of producing systemic electrolytic alterations and also producing alkalosis. That is an example of sodium bicarbonate. Non-systemic antacids, these are the antacids which are not going to be absorbed by the blood and thus do not exert an appreciable systemic effects. This group is further subdivided into following: aluminum containing antacid, calcium containing antacids. So antacids are mainly classified mainly broadly into the two types. One is systemic antacid and non-systemic antacids. Systemic antacids are the antacids which are going to be absorbed by the circulatory system and it is going to produce alkalosis. Means all the antacids are alkaline in nature. So alkaline in nature. So when you are going to take uh, more usage of systemic antacids for longer time, it is producing alkalosis whereby increase the blood pH. So the systemic antacids are unabsorbable antacids. The example for systemic antacids is sodium bicarbonate. Second one is non-systemic antacids. Now I'm going to discussing about the what are the ideal requirement, ideal properties is going to be required for the antacids. Means some basic properties or the some basic requirement or ideal requirements should have to be there for the antacids which obeys the properties of antacids. So now discuss one by one. Number one, it should be insoluble in water and as fine particle forms. Means whatever the antacids is going to be there, it should have to be insoluble in the water so that it cannot so that it not produce any systemic alkalosis. If the given antacid is going to be dissolved in water, then it is going to be absorbed by the bloodstream and it can be produce alkalosis. That is going to be called as systemic alkalosis. So there will be chances of alkalosis. So all the antacids, whatever the antacid, it is basically insoluble and non-absorbable and as for having the fine particles. Second point, it should not be absorbable and causes systemic alkalosis, what I discussed before only. So almost all antacid, it should not be absorbed by the blood or circulatory systems. So it should not causes any type of alkalosis. So that is a second requirement. Third requirement, it should be able to exert its effect gradually and over a long period of time. Means the effect of the antacid should be gradual, steady, and it should have to effect for the long time period so that the patient can feel the effect of antacids. Fourth one, it should not be laxative or causes constipations. Means the most of the patients who are using antacid is geriatric in age, geriatric persons or geriatric peoples. So there will be chances of having the constipations when the person is or else it will also causes laxative when this type of antacids are going to be used. So the basically the ideal requirement means that antacids should not produce any laxative actions or else not causes any constipation to the patients. That property should have to be there for the antacids. The next one is it should not cause us any side effect. This is a major one because most of the antacids is not going to be most of the antacids is going to be taken for long durations. Means it can be taken for 1 month, 2 months, or 3 months. However, whenever up to when the person does not feels that I am means the acidity is going to be less. So up till their usage of this antacid is going to be more. So all as the antacid usage is for long term, it should not causes any side effect to the body system. So this is the ideal requirement. So next ideal requirement is it should be stable and readily available. Means it should be stable in nature. It should not change in physical or chemical properties, and it is going to be readily available in all the places or chemist shops. Second, next point, the reaction between antacids and gastric hydrochloric acid should not produce large volume of gases. That is also one of the requirement, because as the gas as the antacid is an alkaline, when it is going to be reacting with hydrochloric acid, there will be chances of producing more carbon dioxide. So there will be chances of flatulence. So that should not be happen in this anti-ideal requirement of antacids. Means you should not react with the with the hydrochloric acid and should not produce any large volume of the gases. Next, the antacid should buffer in the pH range from 4 to 6, or else it can be 7. So this is the ideal pH range for the antacids. Next, the antacid should probably inhibit pepsins and proteolytic enzymes. Probably it is going to inhibit the pepsins and proteolytic enzymes, which are one of the requirement of the ideal antacids. So this is all about the basic and ideal properties of the antacids for the antacid preparations. So now let us see one by one the compound monograph analysis. So the first compound is sodium containing compounds. Under the sodium containing compound, the first example is sodium bicarbonate. So the sodium bicarbonate is under the class of systemic antacids. The formula is NaHCO3. Molecular weight is 84.01, and the synonym of the baking sodium bicarbonate is baking soda. As per the Indian Pharmacopoeia, the percentage purity should not be less than 99% and should not be more than 100.5% of sodium bicarbonate, calculated with reference to dry substitute. Next, we come to the preparations. So, the sodium bicarbonate on the small scale means in the laboratory scale, it is going to prepare by passing carbon dioxide gas through a solution of sodium hydroxide. The solution is then saturated or concentrated to get the product of sodium bicarbonate. So this is in a small scale preparations which can be adopted in the laboratory wise. So the here the equations is there. So NaOH plus CO2, they're going to form a Na2CO3 plus water molecule. So further Na2CO3 is going to be saturated with carbon dioxide, they're going to produce sodium bicarbonate. On industrial scale means if the same process, if the same sodium bicarbonate, if you want to prepare in a big way in bulk quantity, the process is going to be called as a Solvay process. Here this in the Solvay process, the brine solution means the brine solution is going to be saturated with the ammonium bicarbonate, that is going to be saturated with ammonium bicarbonate to get the sodium bicarbonate salt. So that after the solution is going to be saturated, it is filtered and passes through the carbonating tower, so that it is going to be get the precipitation of bicarbonate. That precipitation is going to be filtered out and dried and kept in a bottle. So this is the preparations which are going to be adopted in the big and large scale industry.